right. Well, good afternoon, everyone. Good morning from California. That's where I'm at today. Welcome to today's Echo session and welcome to our new attendees. My name is Benita Arokiraj, and I serve as a population health analyst and Echo lead for the Constellation Regional Collaborative, within which our Echo series is housed. So I'm joined today by a few of my CRC team colleagues who will be supporting recording of the session, sharing slides, chat monitoring, all of the above, and I'm very grateful. If this is your first time attending, this is just a reminder to stay till the end to fill out the post-ECHO survey to receive education credits. Thank you again for joining. We're excited to dive into today's presentation. And Sydney's currently sharing the agenda. So we'll begin with a quick round of introductions from my team, followed by subject matter experts who are joining us today, and also participants. I don't know if I shared this in the chat earlier, but let me go ahead and paste that for people who are coming in right now. So after introductions, we will have a didactic and case presentation by Lisa Graham. We're going to be learning about the combined collaboration of diabetes care education specialists and community health workers. And for the case portion, we'll be discussing a solution, a pilot program to address some of those issues that we'll be talking about later in today's meeting. After the presentations, we will have a 10-minute section for question and answers and discussion. Keep it interactive. Echo session's all about peer-to-peer learning and all of that. So we'll have questions, and then at the end of today's meeting, we will discuss our next Echo session, what topic we can expect, who will be presenting next month, and a little bit of fun credential updates from the team, followed by the post-Echo survey, which is our evaluation component. Next slide. Yep, so I pasted in the chat, but attendees, please feel free to share the following in the chat: your name, employer, organization, position, credentials, and optional icebreaker if you want to participate is something that you're looking forward to this spring. Looking forward to spring hiking. Love that. I would say I want to agree, but that would be after I've taken Zyrtec for all the pollen in Georgia. Adrian says, looking forward to learning to play pickleball. That's amazing. The weather's definitely getting warmer. Jackie says, spring blooms. Yep. All right, as more responses keep coming in, I think we can get started with our Constellation Regional Collaborative team introductions. I can go first. I've already shared a little bit, but I'm Benita. I serve as a population health analyst and echo lead on the team. My background is in public health and health equity programming. Before joining this team in the world of cardiovascular health, I worked in violence prevention for about 3 years. Over to you, Sid.
Hey everyone, I'm Sydney Fleming, the Outreach and Community Engagement Specialist. I'm also a community health worker. Been a community health worker for 5 years, I think now. I am in Mobile, Alabama, so I worked with the health department previously. And now I'm happy to be here. Been here for 2.5 years now, so happy to have you all on the Echo. Sylvia?
Good afternoon, everyone. I'm Sylvia Coleman. I'm a strategy consultant with the Regional Collaborative, and I've been working with the team for almost as long as Sydney, a couple years now, over 2 years now. One of my roles, I help out in however the team needs me to. My background is in nursing and public health with a huge passion for heart disease and stroke prevention and hypertension control. So this is perfect place for me to be working. With our Learning Collaborative, some of you are in the Learning Collaborative. With our Learning Collaborative, I'm one of the coaches from a clinical policy and quality improvement standpoint. back to you, Anita, I think. Benita.
Yeah, so I'm not sure if Maxine's joined, but Maxine Arena is our program manager, our great boss. We love her. She supports all of our program lines. And then we also have Agner Munoz, who's also not able to attend today. He's a certified community health worker in South Carolina and serves as a community health specialist with our team. Next slide. All right, so over to introductions from our subject matter experts. I did see Valerie paste in the chat that she's not able to come off mute, but we have Valerie Perez joining today, located in Central Florida. And I believe I saw a few other subject matter experts on the call. So if you're here, please feel free to come off mute and introduce yourself.
Hi, Benita. It's Don DePetti from University of South Carolina School of Medicine. I'm a physician, a general internist that specializes in hypertension and vascular disease. And I've been with Constellation as a board member and the foundation for a number of years, as well as the Hearts in the Americas and the Global Hearts Initiative as well, which aims to increase hypertension and NCD control worldwide.
Thanks for joining us, Dr. DePetti.
You're welcome, Benita. Benita, by the way, the link did not work until Emily just sent me another one.
Oh, no. Okay. We'll get that sorted.
Just so you know. Yeah.
Yep.
I can jump in next. Good morning, everyone. Jeff Bretler. I'm an internist, a hypertension specialist working with the Kaiser system in Southern California. I help oversee.
Dr. Bretler, I'm not sure we can hear you quite well. It's very low on my end.
How about now?
Nope. Still very low. I can barely hear you.
I will drop my introduction in the chat.
Okay. That I heard. Got it. Thank you.
Hi, everyone. My name is Emily Ridley. I'm a subject matter expert with the Collaborative. I'm a clinical pharmacist based out of an internal medicine residency clinic within Prisma Health in Columbia, South Carolina, where I serve primarily low-income urban population, but also we have a lot of rural patients as well who come to Columbia. And on a daily basis, I work with our patients in helping improve hypertension and diabetes control. I've worked with efforts across our health system and quality improvement efforts regarding hypertension control, and have served as a consultant with Hearts with PAHO in the past. Nice to see everyone today and looking forward to the.
Thanks, Emily. Thank you for joining. As a part of our subject matter expert panel, we also have Honey Estrada, who's a community health worker and brings firsthand insight from the CHW field and is a strong advocate for health equity. We also have Dr. Daniel Lackland, who, as many of you probably know, is also a nationally recognized leader in the world of hypertension, cardiovascular health research, and policy. We're very grateful to have our subject matter experts who contribute to the series planning and all the efforts for the Constellation Regional Collaborative. So thank you again for those of you who were able to make it today. Next slide, Sydney. All right, so to introduce our didactic and case presenter of the day, we have Lisa Graham, who's a registered nurse, certified diabetes care and education specialist, and board certified advanced diabetes manager with more than 30 years of healthcare experience. She's the founder of Renew and Live LLC and the Diabetes You Can Win Foundation, which are organizations dedicated to expanding access to diabetes education, prevention, and community-based health programs. Lisa previously coordinated the Northside Hospital Diabetes and Nutrition Education Program, and now focuses on delivering innovative, community-centered approaches to chronic disease education. She's passionate about improving health equity, works to empower individuals and families with the knowledge and support needed to successfully manage and prevent diabetes. Lisa, please feel free to share more about your background and take it away for today's didactic presentation.
I don't see, hold on. Okay, there we go. Thank you so much, Vanita. It's asking me questions over here, so I'm trying to make sure that I In the right place. Good afternoon to everyone. Can you see my slides?
Yes.
Okay. So, again, thank you for the introduction. I'm excited to be here and just share a little bit about what we're doing here in Georgia. I love all of these California roots because I'm originally from Los Angeles, born and raised there, but now reside in Georgia. So excited to hear that. Just want to start here a little bit, and this again with who I have on the line. I'm sure that many of you are familiar with this, but I thought it was important just to start a little bit in regards to what we're looking at in reference to diabetes cases. Some of you may or may not know, just on Tuesday, we had Diabetes Alert Day, which is an initiative from the American Diabetes Association. And really the goal is to bring awareness. As you said earlier, I've been 30 years in the space and over 20 years in diabetes. And one of the things I think that is always so concerning to me is that during that time, there's never been a huge drop in the numbers. And we just had, as you can see here, our numbers are, going up again. So this is something that we really need to look at, and there's so many people working on various solutions of how we decrease these numbers. But the other thing is that looking at is the cost of diabetes. I know that many people here on the line talked about when we look at heart and we know diabetes affects so many organs in the body and the complications potentially from diabetes that's not being managed well. So again, wanted to talk a little bit about that as well as share what it looks like in Georgia. Georgia, as many of you probably know, is a part of the diabetes belt. Again, the numbers that we are seeing here definitely higher than other parts of the country. One thing here that I want to talk a little bit about my organization, Diabetes You Can Win. The name came from the fact that I do believe that we're losing a fight that we can win, and winning that fight is through education. So with Diabetes You Can Win, which is a nonprofit organization, focuses on bringing education to those communities that are at greater risk. And we do that by providing free blood pressure, blood glucose screenings, as well as education. It's all about taking it to where people are: senior centers, community centers, health centers. And as I said, the goal is hope that we're believing that by doing this, that we're going to help be able to improve those outcomes. You look again at the cost here in Georgia. So diabetes is something that we definitely need to figure out how we're going to attack it and what we're going to do to make those changes. This again is what we're looking at it, and based on who I have on this call, this is probably not a surprise, but we look at the individuals who are affected by diabetes from a national perspective, and then the rates here in Georgia. And as you can see just here with these particular rates, it again is much higher in Georgia. And this is why wanting to focus and look at how can with here in my new home, how I can do better with improving outcomes. When we look at, as Benita mentioned earlier, I'm a certified diabetes educator. With educators, we can have educators that are certified and diabetes educators that are not certified, but still working, of course, in the space. I also sit with my professional board. I'll talk a little bit about them in a moment, the Association of Diabetes Care and Education Specialists. And as we know right now that we have, when we look at certified diabetes educator, the number's 19,000 here in the US, which means that we have, as it shows here, one diabetes educator per 1,000 people. We just looked at the numbers: 40 million living with type 2, over 100 million living with prediabetes. This is something that we definitely cannot do by ourselves. We need help to make sure that we are reaching those communities, as I said, that are greatest risk. And then when you look at Georgia, the numbers are even lower in regards to who we have to support us in this space. And here you look at one educator for every 2,000, of course, individuals. Who are diabetes educators? we look at most of the educators. As I said, we have different disciplines. We have diabetes education specialists, then we have those who sit for a certification exam, and then we have also those who sit for an advanced certification exam. These individuals, as you can see here, dietitians, pharmacists, social workers, PAs, also sometimes exercise physiologists. Usually these individuals have clinical backgrounds or again, some sort of health background that's set for this particular exam. But as I said, there's not enough of us out there. And again, this is why we need the help and the, of course, support. When we look at community health workers, I've heard several as well on this call that are community health workers. So I've worked with community health workers over the years, and one of the things that I have been very impressed with is the advanced training now that community health workers are being given, and the other thing of just really seeing them in so many different places. When we talk about the communities at the greatest risk, they are essential in those communities, because what we know is that with many of these communities, the challenge is building trusting the healthcare system based on just past experiences. So I've listed all of the things here in a sense of why community health workers are important and vital to when we look at winning this fight with diabetes. As I said, the diabetes educators oftentimes will bring that clinical expertise, but we need someone to help us to definitely solidify our messages and take those messages of. I really feel hope. I always tell people one of the things that I love about diabetes education and being in this space is that this is something truly that we can do something about. We know how to manage diabetes and we know how to prevent it. So getting that message, more of that message, of course, to the people, and having trusted messengers to help us deliver that message is, I believe, so important. When we look at one of the things that's happening, and I think it's happening across the country, but I've sat in on many of the calls, state calls with our community health workers here in Georgia. We have some coalitions, of course, of community health workers. And one of the things that I kept hearing from the community health workers and those, in a sense, that are working to support them and allies for community health workers is the funding piece, the ability to have them paid outside of grant funding. And sitting in as an ally on those calls, one of the things I thought about, again, my challenge of trying to meet the needs of all the community just for me, commitments that I have, is that being able to bring them, in a sense, into the fold and look at how we can get them funded outside of course, typical grant funding. So one of the things that, some may or may not know, but diabetes education is a billable service. It is something that, based on, physicians have the ability to certain codes that they can utilize. And then we have accredited diabetes education programs. So these diabetes education programs actually, once an organization has become accredited, has certain codes that they can use to bill for education. The two governing bodies of that is the American Diabetes Association and also the Association of Diabetes Care and Education specialists. The other program is the Medicare Diabetes Prevention Program. So this is now also with diabetes prevention. This is looking at our senior population, which we know are at greatest risk, but now we have a code that we can bill and be reimbursed. Private insurance, of course, we know grant funding, but when, of course, just kind of looking at this and exploring this, I thought now we can create a source of revenue that would give us the ability to pay community health workers that work within these accredited diabetes education programs. So one of the things that, as I was thinking about this, and it really brought me back to, it's been a little while since I've been on the nursing floor, but when I was, of course, in the hospital working, oftentimes I might have six, seven, eight, it depends on what kind of day that was, eight patients, but I always had alongside me, patient care tech, a nurse's aide, someone that was working with me to make sure that I, made it through my shifts as a nurse. Sometimes said we thought about just getting, of course, through the shift. But that particular individual that worked with me, again, was like my right hand. I might have had six patients. I've got one patient going bad, and then what's going on with the other five, of course, patients. Nurses are on the floor, but nurses have their own patients. But who I had at my side was that patient care tech, whatever, again, different names that you want to call that individual, but that was the individual that was there to make sure and look out and let me know what was happening with checking in on those other patients, making sure that even if something was going with them on with that in one of those patients, that they could find somebody to help and support. And as I thought about that collaboration, that partnership, and how important that was to me as a nurse on the floor, this is again when I thought about, of course, the community health workers. So my solution, in a sense, of when we look at how do we, of course, fix this problem, meet this great need of course, more diabetes educators. This is when I thought about how I can incorporate the community health worker. I have one of my colleagues that works with me, Latorian Smith. I give her all of the praises because I kind of had the idea and she made the vision come alive. And we worked on this curriculum. And I won't say that we're the first ones, of course, that is doing this. But one of the things that I saw was a little bit absent from some of the other programs that I was looking at is that it was more the information that was given was more surface for the community health worker, but I wanted the information to be more comprehensive because I wanted to create an individual, a partner, a teammate that really knew, in a sense of, when we talk about diabetes management, the depth of what we go into when we're educating an individual and being able to report that information back to us. So that was what we looked at, really putting together something, like I said, a little bit more comprehensive for that community health worker. Again, always being mindful of scope, because even as diabetes educators, we all have a scope that we adhere to first. And then on top of that, then we are a diabetes educator. But as I said, we kind of about this, put this in motion. And one of the things that we started with interviews, interviewing candidates December and January of this year. One of the things that we really wanted to make sure that we found is that they had completed a community health worker training program. There are many, and like I said, I've worked in past who had not, community health workers who not have been through one of those, of course, programs. So that was very important to us because of all of the information and skills and things that they learned there. We thought were important as we brought them into this new certificate program or this pilot program. A strong interest in diabetes education. I tell people, diabetes education, all the things we do, but all we do is talk to people all day. So it definitely is having a passion for people, communicating with people, and again, just in the community, working in the communities, and especially these communities that are at greatest needs here in Georgia. And so we were able to launch our first pilot a cohort group February of this year. So just a little bit about what we've done so far. Again, this is very early. We're just here in March, but we're really, really excited about this. We had, again, a strong just interest in the program. One of the things that we focused on, this is just a picture of the flyer that we've kind of put out. We have this at various events when we go out. I participate in a lot of coalition meetings, as I said, working with the community health workers network here in Georgia. But we looked at that individual that will work with us is that we will call them the diabetes care champion. Um, as I said, I could not do what I did in the hospital alone. And with this, that I'm where I am now in the community, I cannot do that alone. So I do see them, of course, as champions. With this certificate program is looking at now, it's about 11 to 27 hours of program instruction. And this is including again the it's about 11 hours of the actual education program, which actually includes a skills day. So we bring them in person and we go over blood glucose screening, blood pressure screening. One of the things that I thought was very important as we're coming into this technology space in diabetes management is training them also about CGM. So putting a CGM on them, helping them understand what that, of course, what that looks like, what information that a patient can obtain from a CGM. The other thing we looked at is looking at talking to them about diabetes distress. What do those tools look like? We know that a lot of people are suffering, of course, from depression. So all of these things are part of the skills day, bringing them together to go through these different tools in a sense that we use in diabetes management. We looked at this past, of course, cohort. It was a virtual meeting for the education, and then the skills portion was in person. And we look moving forward that it may all be in person, but it will all in person, definitely virtual, but it will always have a skills day. So we'll have a skills day to bring them and be able to go over the various skills and practice some of when we think about questions and surveys and different things that we have, of course, with the individuals. When, as kind of talked about before, the comprehension, as I said, as we reviewed programs, putting this program together, that was the thing that we felt, in a sense, was really missing. And we wanted to make sure that in a sense that we had the opportunity to like I said, just do a deeper dive with of course the individuals. um, Kind of shared here a little bit in regards to some of the things that I talked about that we went over in our educational programs. And what extends this to that 27 hours is we also gave the community health workers that came on board, if they were not already diabetes prevention coaches, lifestyle coaches, I am a master trainer select, and I can train individuals as a DPP lifestyle coach. So not sure if many people know, but there is what we call the CDC National Diabetes Prevention Program, which is a year-long program. We saw some of those numbers. Those are the numbers that are at the greatest right now when we look at prevention. And so one of the things are pre-diabetes. So I wanted to bring them in to also be able to support those individuals that we see who are living with pre-diabetes. This is something that, again, that they can lead a class on their own in regards to diabetes management. That will be the diabetes educator giving the education, and then that the CHW will support that patient once they leave the education. Some people don't realize that when we look from an insurance perspective, we only get 10 hours of diabetes education for the lifetime of that individual. If you're dealing with someone who is uninsured, of course, that doesn't apply. And it's, how do we get them, of course, that information? So with having the diabetes education side, and like I said, them being an extension of that once they've been educated by the diabetes educator and then turned over to the CHW to kind of support with, follow-ups, check-ins, we talk about support groups, all of those things that they can help in making sure that people have, retained the information, that they're being supported with the information that they've given. And then on the pre-diabetes side, actually being able to work with those patients in group via the CDC DPP Lifestyle Change Program. And as I said earlier, my organization, Renew and Live, we actually have the ability to be able to bill Medicare, and we're an accredited program also to be able to build for diabetes education classes. So this was a win-win. We didn't have at this point, one of the things that we told them coming in, it wasn't like we had funding. That's the beautiful thing of a small grassroots organization, to be able to say, hey, we may not have this fund, but we're going to move forward. We know this is something that needs to be done, but this was a perk that I was able to offer them, because this particular training can run from $600 to $1,200. So there, as a thank you to them, to be able to say that we'll allowing you to be able to come in and get this additional training. So they will be also, like I said, offered that. And we're looking now that to start our next group in May. We are working on, we found a lot of, as we put programs together, and we kind of stalled a little bit with putting it out there, but then Latoya and I said, well, let's push it out and just kind of see where we are. So one of the things that we've also already found is just making some adjustments in the curriculum in regards to how we share information. One of the things that we did not have there, and we found that as we started getting questions from the CHWs, are myths about diabetes. So we know there's a lot of things that are out there, and especially with this onset of when we think about social media and all of the things that are there. So that was something that we changed just based to this first cohort. Making sure that we were clear, in a sense, on the expectations of the program is also something that we found that we needed to make some adjustments. And again, also with a little bit more information, because the huge part of education is around exercise and nutrition. So we also made some adjustments to how we were sharing information, realizing that some of our community health workers also didn't know how to read labels and didn't really understand the what carbs, and especially if they had not been working in the space. So we did some education there, but actually doing a deeper dive after speaking with some of the educators the community health workers that we had in the program. So with that, one of the things I leave here, and it's going to give us some room in a sense to kind of go a little bit more, but because would love, and especially with community health workers on the phone, just kind of your questions and any comments that you have. But one of my favorite quotes, again, here that you can see, alone we can do so little, together we can do so much. I think it's so important that, as I said, being in the healthcare field as long as I have, there's a lot of talk sometimes about us coming together and really recognizing. But I think it's important that we recognize each other's strengths. And again, as I shared the list of you with the community health worker strengths, but my frustration as a small community-based organization is that what weighs heavy on my heart is my inability to be able to reach more people. So I know that I need to, in my thoughts, is building a workforce for me to be able to reach those additional, of course, individuals. So as the title, we're stronger together. I always say that, it's such a cliche, but it's so important in regards to the work that we can do. So I do want to thank you again for giving me the opportunity to be here. And again, I just want to open up for us to be able to talk more. Any questions, or I'd love to hear what some other people might be doing, of course, in this area. And I hope I'll be able to come back and share more as we continue with this program. And what we find and how we start to implement them and put them to work in the communities, because one of the things as a part of their skills, they have to attend so many of our community events, as well as sit in on classes. So they're kind of in that phase right now. So again, thank you for being here, and I'm excited about the future and the work that we can, like I said, we can do together.
It looks like T has a question. Go for it.
Mhm.
First of all, I just have to say, first of all, Lisa Graham, thank you so much. Thank you so much. You made my heart smile, especially after I just talked to another individual that's going through something. And I'm like, yeah, you don't understand. You need to come with me. Let's do this thing. So, everything you said today was it was a blessing. It just, confirmation. Sometimes you need that additional confirmation
Yeah.
and additional, like, remembering, oh yeah, I do know this. I do know
Mhm.
this.
Mhm.
Okay, I have been creating some programs and some trainings lately. And so I have been also thinking around that, being able to pay other people. How do I bring these folks in and make sure that I'm also able to give them a living wage? Because I
Yeah.
really hate bringing in individuals and not being able to make sure I can pay them.
Yeah.
And not just pay them, but pay them what they're worth. Because
Yes.
so many people do not pay people what they're worth.
Yeah.
Um, so this is another piece that can add to my piece. I'm always like, they're always talking about multi-layering. And I'm like, oh yes, I can add this to my piece, and this would help me with this piece. So
Mhm.
I just really appreciate you today, and I will be getting in touch. I will be getting in touch with you.
Well,
Yes. And thank you for the work that you've done, and thank you for being able to bring this. And alone we can do so little, but together we can do so much. And I totally agree with that. My version of that is together we what is it? Together we aspire, together we achieve.
yes.
So
Yes.
same concept of come together is what it is about right
Yes.
now. And
Yes.
for us to be small individual consultants and small nonprofits and small CBOs, the way we come and we are effective is understanding that we cannot do it all by ourselves.
Yeah.
And partnering, though, gives us a safe haven that we can start to feel some, okay, we can be comfortable in this space, especially when our desire is to help other people. So thank you so
Absolutely.
much.
Absolutely. You are so welcome. And I thank you for that because I too also believe in just confirmations. And that what you said, I'm giving you a confirmation. You're giving me one as well. And I do, I believe that it is these small grassroots organizations on the ground that truly are helping and we don't always get that recognition, but we're helping to improve and increase, since numbers when we talk about those positive outcomes. And so I look forward to hearing more about your work. And that is one thing that I do all the time is that if I can help another person, because at the end of the day, it's about helping people. It doesn't make, I don't need to see everybody. I need to get information out, of course, to people. But if someone else can, it's about seeing people and helping people. So T, thank you so much for all of those words.
I love that. And then we have a question in the chat from Allison.
Mhm.
Can you please share more about the process of being trained as a CDC diabetes prevention lifestyle coach? We have a community health worker who could be an excellent fit for that.
So you have so I am a master trainer select, meaning that I can train other CDC lifestyle coaches. I train them for my organization, but there are organizations out there, DTAC, and it is a 16-hour course, and it's really about facilitation skills, teaching you how to manage a group. And it can be done virtually as well as in person. I know DTAC, which is a part of Emory University, which is a nationwide training program. But with going through the program, it's really learning those facilitation skills, learning more about the CDC diabetes prevention program and how it all works. And just quickly, if you don't know, it is a year-long program. It's a lifestyle change program. We don't see people for a year. It's 16 weeks. People come in for an hour group setting. We weigh them. We make sure, they check in with exercise. We look at food plan. I always tell people we're not the food police, so we're just trying to make sure people are staying on track. They set goals to lose weight, and you've got the first 6 months, and then which is again going. There's 26 different lessons that they go through, and then the second 6 months is maintenance. So when you're trained how to facilitate that group, how to be, come alongside that group. We're not necessarily I know my colleague that taught me, she says you got to take off your educator hat, and we're a facilitator. We're not telling people what to do. We're coming alongside. So that is what that training is all about, and it is a certificate program. So it's not a pass or fail. You don't have to take a major test, but what you do is that during that forum, you will do kind of like a teach back, and pretty much successful of that teach back that people are, have the certification as or a certificate as a DPP lifestyle coach. And they have tons of supportive educational opportunities to help and build your strength and your skill in that space. So I hope that's helpful.
Thank you for that. Yeah, and we have a lot of praise coming in through the chat if you wanted to read some. And I'll read Valerie's message. She said, "This is fantastic. And you've brought in the core knowledge to diabetes management. Once someone's diabetes is under control, they can then change the target focus of their health on hypertension and cardiovascular issues. It's a trifecta of health issues we see here in Florida."
Yes.
And I can definitely vouch for that. I do have a lot of relatives who have either diabetes or hypertension or both. So very prevalent.
Yes. And one of the messages I think that we share with, because unfortunately, I say if you have diabetes, we end up with heart disease, we end up with diabetes. And a lot of the things that we teach around diet, exercise, if people have weight to lose and losing weight, I tell people if we do these things, we can kind of knock out a whole lot of other things. So it's going to help with, high blood pressure, cholesterol. So again, just focusing on this area, we can attack a lot of different areas. So true. Thank you for that.
Did you have a
Question.
question?
Is this a you said sorry, you said the train the trainer is the teaching, the course is a train the trainer course.
Well, the course in regards to the DPP lifestyle coach
Yes.
training, so that is it's not necessarily trainer. You usually have someone like myself, which is like I said, a master trainer, and we are
Right.
instructing those individuals who, in a sense of um, who want to be lifestyle coaches to be able
Right.
to, yes.
Okay.
Hmm.
So we're still training the participants and the community,
Yes.
but
Yes.
is the trainer model kind of knows um of course wanting to know more. So how do you get to the train the trainer model? How do we get to your status?
Oh, to my status. So, so both of my organizations, we offer the DPP lifestyle program. So that's simply if you go to CDC, looking at the National Diabetes and Prevention Program, they'll have more information about you wanting to start a program. So it starts there. You're a coach. You go in and you actually say, I want to start a program. So we have, like I said, we have the program under both of my organizations. After training for so many years, then they give you opportunity to apply. So it's something that you have to apply for, and then you have to be interviewed for, and then they decide if they're going to give you, again, the ability to sit and take that training as, like you're saying, to train the other. Of course, trainers, but usually you have to have delivered the program. I've been delivering the program since 2017. Both of my organizations have full plus recognition, and that's based on our outcomes. And because of that, and once you get to that status, then you're able to apply for Medicare funding, and you can, like I said, the individuals, who are on Medicare. Part B, that we can actually bill Medicare for that. And you're looking at probably, right, and which is not, I said it's not something huge for a large organization, because I worked for a large organization and we know they've tossed some diabetes education because it's just not as profitable as other things. But for smaller other organizations, you're looking at probably a little over $700 per participant that comes through the program, and they've made that a little bit more flexible, the new fee schedule around how people are, of course, reimbursed. So it can be profitable for, like I said, smaller organizations. But the key is starting an organization, getting an organization code, starting a program. After so many years of starting that program, then you're able to apply to be a master trainer select. Is that
Awesome.
helpful
Thank
to
you
you?
so much. Yes, that
Mhm.
is great. And
Yeah.
that is what I want because
Yes.
that's so often things are done and there is no equity put in. So
Yeah.
I'm grateful that that is the way it is because then you make sure that you produce quality. So that's great. Thank you so
Yeah.
much.
Yes, yes. And it's been a while because I think of the time when we first started talking about pre-diabetes and we really didn't have education programs. And then we had an education programs, then we didn't have any way to pay for the education program. It's the story of sometimes with healthcare, but we're getting to a better place. And again, we know how like just as I said, impactful that these programs and educational opportunities can be for those that are living with diabetes.
I totally understand. And I'm a former paramedic. I became a medic in 2010. So
Mhm.
I totally get the advancement of that. So that's why I'm curious. So
Yes.
thank you.
You are welcome.
We have two more questions in the chat that we can get to, and then I think we can move on to our remaining agenda items. So Valerie asks, how has this program worked with culturally specific nutrition when working with community members?
And is that the DPP program or just diabetes in general? And I can just speak to of course both of those.
Mhm.
I know that one of the things that we are very aware of in a sense as diabetes educators and even in the lifestyle change program is that um, everybody doesn't eat the same thing. So we have a lot of education opportunities to kind of explore that. I know personally, I work here. We have a huge refugee community that's here in Georgia. So, I've had contracted work to go in and work with them. And oftentimes I say to them, I need you to come and tell me what are the foods that this particular population eats. We just had a project last year that we were working on with Southeast Asians, and I actually was had one of a fellow that was working with me that was of South Asian descent. So we do have some things that are generated to kind of speak to those different cultures, but she was actually able to create some documents that we could use within our organization, and we utilized in that educational project that we were doing with that particular population. But to your point, it's always very important. I remember years ago, I had a Southeast Asian individual that came in and we were going over a diet review, and they talked about that they were eating tortillas. And I said, do you mean roti or chapati? And their face lit up. It was like, you know what that is. So it is important that we meet people where they are. And if we don't know, we need to get somebody on board that does know. And then we need to make sure that we're addressing those individual needs, because it is an individual journey when we're looking at diabetes or, of course, prediabetes. I hope that helps.
Listen, I am like, I don't know if to help others, but that is like a because okay, so another part of this is I'm originally from the UK and my family's from the West Indies. And so I grew up with people from all over the world.
Mhm.
And it's like I'm getting ready to go to my friend's Indian wedding and I'm like, listen, y'all don't know food. I'm sorry you don't know food, but if you come to me with a program that is not culturally appropriate, you are just giving me nothing.
Yeah.
So, oh, music to my ears. Thank
Yes. And we're excited too. We just received, we were in, they were giving ways, and we were one of the recipients of the Old Ways curriculum, which is a plant-based curriculum, which is culturally sensitive. So we're about to roll that out as well, because to your point, it's very, very, food is the number one conversation, and we've got to meet people where they are, because once you tell them no to something, then they're going to eat it and not tell you, or they don't want to hear anything else you have to say. So we have to make sure that we're meeting people where they are.
Really great information. I have so many questions, but I will cover the one from the chat and then send you another email after this.
All right.
Jerry asks, thank you. Can we participate in becoming trained if you do not live in Georgia? I work as a health educator and I'm not currently a CDCES yet.
Yes, so my information is here. Please reach out to me. I have so many people reach out to me on LinkedIn, because I sit on the credentialing board as a mentor. So if you go to the credentialing board, I'm there as well. I always tell people, you see a little, of course, gray in my hair, but I say I'm not ready to hang up my coat. But what I do think is important is for me to be a part of training this next generation of health leaders. So I will help in any way that I can. So please just reach out to me, and I will, whatever information you need, I'll make sure I do that. I get a lot of those messages on LinkedIn often.
Awesome. Thank you. Thank you so much for the great presentation and all that amazing insight.
I love you. That's awesome. Yes. I wish so many other people, I'm like, if you get to that point, you have to reach back. You have to turn back and give it back, so that make sure that it's rooted in the community. Come on.
Yeah. Absolutely. Absolutely.
All right, and I know Lisa shared her email, and I will also share the slide deck with you through the iEcho platform, so please feel free to reach out for more questions. And thank you, Sydney, for resharing. Can we go to the next slide? Okay, I know we were talking a lot about nutrition education, so that perfectly ties into our next ECHO session. So we will be highlighting holistic women's heart initiatives in Georgia. We'll have a didactic presentation by Avril James from Piedmont Women's Heart Program, and a case by Mikkel Carlock, who is the executive founding director of the Her Promise Circle. So I know that both of their programs do cover a lot of health education, nutrition education, so I'm very excited to continue that conversation next month, so please be there. Next slide. Yeah, so a little bit of fun news. In the spirit of supporting healthcare and public health workforce development, we have an exciting update regarding accreditation. So as most of you already know, we've been offering the AMA PRA Category 1 credit for all of our ECHO sessions. But starting this month, we are also now a certified in public health CPH credential recertification activity. So I am slowly building more. It just takes time, but obviously the next step is to get the community health worker CEUs. We're in the process of getting those forms signed. May take time, but slowly but surely getting there. So just wanted to broaden that impact for public health education, especially for our amazing audience, most of you who are public health workers, community health workers, on all of the above. So that's just a little fun update that I wanted to share. And finally, please fill out our post-ECHO survey to earn those continuing education credits and the certificates. We have a new evaluation link, which I've pasted in the chat. It has most of the same survey questions that we've had earlier, just a few additional ones to support this credentialing process. And the survey link will be open for 1 week. So please fill it out by April 2nd. And to those of you who attended January and our February ECHO sessions, I know the certificates are pending, but now we have this new evaluation link established. So once March is done, we'll kind of backtrack and finish January and February as well, so that you all get your certificates and credits as promised. Thank you so much for joining today. Have 3 more minutes in case you had any pending questions. I guess we can cover them, but thank you again for joining. As always, continue to attend our other ECHO sessions. They're always on the last Thursday of the month from 12 to 1 p.m. Eastern Time. And thank you, Lisa, again, for presenting today. It was amazing, rich conversation that I know all of us are fangirling over. So you can expect a lot of questions coming your way.
And thank you,
Thank
Benita,
you
for your
again.
intentionality. I appreciate it.
You're so welcome. You're so welcome. Thank you.